At the, wait. Age 53.
No, not this photo.
3 months back. 3 months back. That is the very reason I was searching this slide, okay? That is the very reason I wanted to show you what difference, practically I had gone through and what I had suffered and how you can improve life. Okay, one can improve life. This is when I had attack on 23rd of December 2011. Okay. This is when I started improving. I had lost 6 kg of weight. With this 6 kg of weight loss, puffiness has gone. Okay. Then after a month, that is after 2 months, 23rd of Feb 2012, this is again Dr. Imtiyaz Kondkari. And today is 16th March, this is Dr. Imtiyaz Kondkari. Okay. Now,
3 months.
yes, now 3 months are not completed. On 23rd March, I'll be completing 23rd month. Okay.
What's the age?
53. This is just 3 months back. I showed you this again. I want to show the slides, okay? Concentrate on slides. This is 3 months back photograph. This is 3 months back photograph. Okay. This is again after 15 days, after 1 month, and today. I have not completed 3 months after my attack, okay? I had attacked, I have not completed 3 months. Now, I have got a habit of, opportunity taking opportunity, or you can call me opportunist. But opportunist in a very social way, not personal way, okay? When I had suffered, I want people should not suffer. Okay. So we are here. Now we'll be talking a bit about heart attack, what is heart attack, what is heart, everything will just brush up, and then we'll talk how we can prevent. This is little about me. I am Dr. Imtiyaz Kondkari. I do all practice this prostate, you can say, rarely treated diseases. I treat rarely treated diseases, obesity, arrest of hair fall, benign hypertrophy of the prostate, diabetes, erectile dysfunction in male, azoospermia in male, then sex part, any advices for about sex, prevention and reversal of heart attack, and treatment of piles without operation. Okay. Now let us see this. This is the first slide of heart. Our heart is like this. So the important thing over here is why we get heart attack. We should know that our heart is also supplied with blood vessels for the muscles of the heart. Now these blood vessels, these and these are called coronary arteries. These are called coronary arteries. Through this the blood is supplied to the muscle, or you can say the mass of the heart. Heart attack. What is heart attack? The other name for the heart attack is coronary attack, coronary occlusions, coronary thrombosis, and myocardial infarction. These are all different names for the same disease, heart attack. Now see, here I have tried to show how the vessels get blocked. Okay. Now this is vessel. From here the blood passes. This is the channel, you can say, okay, from where the blood passes, and this is the blockage. So usually the blood was passing from this much channel, okay. Now just because there is block, the blood is passing through this small place. Now when the blood passes from this small place, people get angina. Angina is Anjana Darad. Okay, angina pectoris. Pectoris is a pectoris muscle over here. उसके साथ में उसके पीछे जो दर्द होता है उसको angina बोलते हैं. Now the heart is like any other muscles, requiring oxygen and nutrient-rich blood to functions. The coronary artery that supplies blood to the heart muscles. I have shown you coronary artery. If you want to see again, I'll show you that also. Okay. So the coronary artery, which supplies blood to the heart muscles, branching out from the aorta. Now what is aorta? And I've already shown you. This is aorta. This red what you can see over here, this is aorta, and from the base of the aorta this artery comes. From the base of the aorta this artery comes, and these are called coronary arteries. So the coronary arteries are a risk for narrowing. The coronary arteries are risk for narrowing. The other vessels are not at risk of narrowing. That means that, okay, the coronary arteries are at the risk of narrowing as the cholesterol deposit called plaques, okay, build up inside the artery. I have shown the artery, transverse section of the artery also. Blood supply to the heart muscles may be compromised or slowed down because there is narrow lane, okay, and this slowing of blood flows to the heart causes pain, and that is called angina. A heart attack or a myocardial infarction occurs when the plaque ruptures. Now see, I'm going to show you, I'm trying to make you understand what actually happens when heart attack you get. Now see, this is the plaque, biggest plaque over here. What happens is, this part, you know, this part of the plaque, it gets out. कभी भी कचरा निकलता है तो जहाँ लूज है, जहाँ वीक है, वहाँ से कचरा निकलेंगे. वहाँ से कचरा निकल गया और आके इधर हम गया. Got it? अब ये ब्लॉक हो गया आर्टरी. Okay, because blood is flowing from that side. Blood is flowing from that side. So इसको थोड़ा सा ब्रेक कर दिया और यहाँ आ गया. और ब्लड के अंदर कुछ स्टिकी सब्सटेंसेस रहते हैं जिसको प्लेटलेट्स कहते हैं हम लोग. वो प्लेटलेट्स के साथ में मिलकर क्लॉट जो है वो उसके मुंह पर बंद हो जाता है. एंड देन there is no blood supply to that part of the heart, and hence we get angina. Heart attack occurs when the blood supply to the parts of the heart muscles is severely reduced or blocked. In both conditions we get angina. They can form a clot that completely blocks the blood flow. If the blood supply is cut off for more than few minutes, for more than few minutes, the muscle cells of heart may be permanently injured or die from the lack of oxygen. Now see, here again I have tried to show you from the figure. Okay, this is aorta and this is coronary artery. This is a block, and what you can see, this blue place is, you can say, muscle damage, heart muscle damage. Okay. So what are the risk factor for heart attack? What are the risk factor for heart attack? Smoking. Top of the list is smoking. And to the surprise, I was not a smoker. I am not a smoker. Okay. High blood pressure. Again, I was not hypertension. High cholesterol. When I had attack, that time the cholesterol was absolutely normal. Okay. Family history. I had family history only. Okay. Which cannot be avoided. Okay. Diabetes. These are the risk factor. Peripheral artery disease. You can see, on your legs and all, some spots you see. These are all periphery artery diseases. Now, if somebody has periphery artery diseases, there is risk of he getting heart attack. What are the symptoms? Symptoms is chest pain. What we say is chest pain. Okay. But if we say specifically, or you can say, if I want to describe classical angina or classical heart pain, it will be described as pressure or heaviness behind the breastbone. This is breastbone. Okay. Now behind this breastbone we have heaviness, radiation. This heaviness or pain will radiate in the arms or towards jaw. Shortness of the breathing, patient will breathe fast, okay, short breath but fast, and sweating. But this is a classical angina pain. That doesn't mean if you have this classical pain then only you are suffering from heart attack or you will be suffering from heart attack. But what is then? Unfortunately, angina has variety of signs and symptoms, and there may not even be specific chest pain. There may not be chest pain, yet the heart may have the attack or the heart may go in failure. Second thing, other location of the pain and the other symptoms may include shoulder, backache, upper abdomen. Here only you have pain over here, specific classical pain over here, but then you can have pain over here. Upper abdominal pain, nausea and indigestion. I may feel that I am having an indigestion. सोडा पिया आराम हो गया, एक बार हो गया, दो बार हो गया. You feel it is indigestion, but that can be angina. Now I will be showing figure. Figure में आपको पेन किधर किधर होगा. This is a figure where you see you can have pain. This is chest pain. This is, you will have pain in this area and in this area also. Okay. Again you have pain over here, no connection direct here. Okay. Again you may have pain in epigastric region where there is no other pains. Okay. Then the fourth whole side, whatever is classically told. Okay. Then only in the neck. Only in the neck. If somebody gets neck pain, do we have any doubt that he must be having angina? No, but it happens. Okay. This two side pain, only there is no chest pain. And back pain on the back, pain on the back. These are also the sign of heart attack. Pain, chest pain during angina or heart attack. Now who are at risk? Women, elderly and people with diabetes. Now people with diabetes, women and elderly people may not show any pain, may not have no discomfort, no pain, no discomfort. Then what they will show you? Generalized weakness, malaise. Yes. And on physical tasks, that on walking or climbing, they may be little breathless. So these are also the sign of heart attack. So we have to be very particular about it. We should know all this sign. Now healthcare practitioners. Now what happens is healthcare practitioners and patients may have difficulty in understanding. He says I am having indigestion. The healthcare person will agree to it, isn't it? And healthcare person will ask, do you have any chest pain? He'll say no. The excluding factor is possibility. There are possibilities. Patient may experience pressure or tightness but may deny any complaint of pain. Because I've shown you the photographs also. There is no pain, no side pain, isn't it? Only neck pain, only epigastric pain. Okay, only back pain. The patient may say no to the question whether the pain is present even though the patient is experiencing